Let's talk about Kentucky's mental health system. Right now, it's at a critical crossroads, and for way too many people, it's a system that's just not working. Today, we're going to dive into why the current laws are broken, and we'll look at a new, evidence-based path forward that could honestly change everything.
You know, this quote right here, it gets right to the heart of it, doesn't it? For thousands of Kentuckians, the mental health system isn't a safety net, it's a revolving door. A painful cycle of emergency rooms, homelessness, and even jail. So let's really unpack why this is happening, and more importantly, how we can fix it.
So let's really dig into this revolving door idea, because the system isn't just failing by accident. It's actively producing these really predictable and frankly devastating outcomes.
And this is what we're talking about. These are the direct results of waiting for a crisis. You get incarceration, you get homelessness, you get emergency rooms becoming the main source of mental health care, and all of this leads to preventable trauma and lifelong disability. It's a tragic cycle that costs us so much, both in human lives and in taxpayer dollars.
But what happens when someone actually gets a chance to break out of that cycle? I mean, this testimonial says it all. Programs that offer real, long-term support can be the difference between a jail cell and, well, what this person now calls a family. Recovery is absolutely possible. We just have to stop waiting for the disaster to strike first.
So why does this horrible cycle keep happening? Well, it's not about bad intentions or people not caring. The problem is literally written directly into Kentucky's law. Let's take a look at the single biggest legal roadblock that's preventing people from getting help before a crisis explodes.
And here it is. This is the law we're talking about, Kentucky Revised Statute 202A. This one piece of legislation, it's right at the center of this whole debate. It is the key to understanding why the current system is built to fail.
So what's the big deal with this law? It all comes down to this one standard, the imminent danger standard. Just think about what that means in the real world. It legally forces families, doctors, and even law enforcement to wait, to just stand by until someone is an immediate active threat to themselves or to other people before they can get them into a hospital for care. It's the highest possible bar you could set for intervention.
This chart really lays it all out. Our current system is totally reactive. We wait for the imminent danger. The proposed reform is proactive. You intervene based on clear medical science. It's a difference between waiting for the entire house to be engulfed in flames and calling the fire department the second you smell smoke.
Now, there's a really critical medical reason why this whole imminent danger idea is so fundamentally flawed. It totally ignores the biology of what's happening inside the brain during a serious mental illness.
And this is the question that comes up all the time, right? If someone is getting sick, why don't they just see it and ask for help? Well, the answer isn't that they're stubborn or in denial. The answer is a real, documented medical condition.
That condition is called anosognosia. And it is so important to understand this. This is a neurological symptom, not a personality flaw. It's a literal blind spot in the brain's wiring. A person with anosognosia is biologically incapable of understanding that they're ill. So Kentucky's imminent danger law completely fails to account for this basic medical reality.
Okay, so if the current system is built on a law that doesn't work, what's the alternative? Well, advocates have put together a really comprehensive, evidence-based blueprint for what real, long-term recovery could look like. And this is it. It's called the Five-Phase Stabilization Model. It was developed by the Kentucky Shattering Silence Coalition, a group made up of families, clinicians, and people who've actually been through the system. And it's not just one single program. It's a full continuum of care, a whole pathway designed to guide someone from the absolute depths of a crisis all the way to long-term stability.
So let's break this down. It all starts with Phase 1, acute stabilization in a hospital, just getting the immediate crisis under control. Then, Phase 2, moving to a structured residential setting. Phase 3 is absolutely crucial. That's integrated transitional living, where people rebuild basic life skills. From there, you get mobile aftercare out in the community, and finally, a long-term treatment team that provides lifelong support. It's a logical, step-by-step progression from crisis to recovery.
And this is the key. This isn't about a 3-day hospital stay and a new prescription. Real, lasting stability just doesn't happen in a few days. Healing the brain takes time. This model recognizes that recovery is a marathon, not a sprint. It's a multi-year commitment, and it's designed to create change that actually lasts.
Okay, so we've got a broken system, and we've got a proposed solution. But what about the cost? And this brings us to what might be the single most powerful argument for making a change, the simple math. Let's follow the money and look at the staggering financial cost of doing nothing.
Okay, here's our baseline. Right now, on average, it costs Kentucky $85 every single day to house a person with a serious mental illness in jail. That is the price tag of our reactive crisis-only system. $85.
Now hold that $85 number in your head. And look at this. The estimated daily cost for a bed in Phase 3 of the stabilization model, that's the transitional living part we talked about, is just $45 a day. And that includes housing, support, case management, the whole shebang.
I mean, this bar chart just says it all, doesn't it? $85 for a jail cell versus $45 for a treatment bed that actually helps people get better. We are paying nearly double to incarcerate people instead of providing the care that they need. The math is just undeniable.
And that's why this quote is so on point. The current system isn't just a clinical failure, it is a massive budgetary failure. Plain and simple. We are spending more money to get worse outcomes.
So, where does all of this leave us? Well, Kentucky is standing at a very clear crossroads. The choice is between continuing to fund this endless cycle of crisis or choosing to invest in a real continuum of care. The path forward is clear, but it's going to require some real concrete action.
And here are the key recommendations. First, modernize that imminent danger law to allow for earlier, clinically appropriate help. Second, actually fund the Five-Phase Stabilization Model across the entire state. And third, expand the whole support system to make it work.
The choice really couldn't be clearer. Continue funding a revolving door of crisis, or invest in a continuum of care that offers hope, promotes recovery, and is actually more fiscally responsible. So I'll just leave you with this question. When you consider the human toll and the financial waste, what is the true cost of doing nothing?